first 3 months, most of the women tend to have this normal symptoms like nausea and vomiting of pregnancy. See for the baby's position, the placenta's position, and also we see Today I am going to walk through your pregnancy. What exactly happens in your pregnancy, what are the tests and scans that is done in your pregnancy. Well, pregnancy is one of the most joyful state every woman experiences. So once you miss your periods, to confirm pregnancy, we have either the urine test or the hormone of pregnancy, which is called as beta HCG, that is measured in blood. And then the next confirmation will be through an ultrasound scan. Usually an internal scan is done to see for your pregnancy, the location, the size of the baby, the heartbeat. And along with that, once the pregnancy is confirmed, we do certain blood tests which are essential in pregnancy. These are called as the booking tests. In this, we rule out whether the mother's health is all fit and fine to carry out the pregnancy. If there is something to be treated, like a thyroid disorder or sometimes sugars in pregnancy, or if the hemoglobin is low, we can find it out early. After that, if everything is okay, we have the next visit at around 11 to 13 weeks, and now we have the important scan which is called as the nuchal translucency scan. This scan is basically done to see if the baby has any chromosomal anomalies like Down syndrome. Along with this scan, we also have certain blood tests which will help us detect better if the baby has any genetic issues. And usually after the scan, we start on multivitamins, iron, calcium supplementations, vitamin D supplementations, because in the first 3 months, most of the women tend to have this normal symptoms like nausea and vomiting of pregnancy. Now, after this visit, the next visit is usually around 16 weeks, where we see for the baby size, growth and everything. And after that, around 20 weeks, we have the important scan which is called as the anomaly scan, where we see whether the baby's parts are all well developed. 4 weeks later, we have the sugar test which is called as the glucose tolerance test. This is basically done to see whether you have developed sugars in pregnancy, which is called as gestational diabetes mellitus, or you have any tendency to develop the sugars in pregnancy. Usually a month after that, you have assessment of baby along with certain blood tests in pregnancy. And after that, at every visit, we see for the assessment of the baby. We ask the mother of the baby movements, because usually by around 6 months, we expect everybody to have a good feel of the baby kicks. And at every visit, we also see what is the weight, height, how much is the weight increased, the BP, and whether the mother is feeling good or she's having any difficulties in pregnancy. And at around 34 weeks, we have the scan which is called as the growth scan, where we see for the baby's position, the placenta's position, and also we see whether the baby is grown appropriately, what is the weight of the baby, what is the water around the baby, all that is assessed. And if everything is fine, around 36 weeks, we have the essential test that we do just before delivery. Certain vaginal tests and certain blood tests and urine tests will be done. And after this, there will be a weekly follow-up. And at every week, we see whether the baby is doing well, the mother is doing well. And we have an important graph test, which is also called as the CTG, which is called as a cardiotocograph test. We have a graphical measurement of the baby's well-being, and if everything goes well, the pregnancy is usually taken till date, and then we wait for the spontaneous pain, or sometimes if you have any disorders, then the doctor will discuss with you accordingly and prepare you for birthing.